So hello everyone, and thank you for joining us today. And we're here just to have a question and answer session in regards to the children's research team and the ATTEST study for our research volunteers who will hopefully be supporting the children's research team moving forward. So I want to thank both Rhian and Helen for joining us today. Would it be okay if you just introduced yourselves briefly? Rhian, shall we come to you first?
Hi everyone, my name's Rhian and I'm a research practitioner in the children's research team. I'm the study coordinator for the ATTEST study, so I make sure that all of the plans and schedules are in place for the patient visits, organise the patients coming into the hospital, and also the staffing and all the equipment we need for the visits.
Brilliant, thank you so much, Rhian. And Helen, would you like to come in?
Hi, I'm Helen Navarra and I'm the manager for the children's research team. We're a large team and we have about 22 members of staff within the team, and we cover all specialities in children, so from neonates, paediatric oncology and diabetes, all areas, and we work with a large group of investigators to make that happen. And it's really exciting that you're going to be involved with the paediatric studies.
Oh, brilliant. Thank you so much. Okay, so what we'll do now is just go in. We have a few questions, if that's okay. So I'll start with the first question, which you may have covered a little bit there, Helen. So the first question is, who are the children's research team? So I guess who's part of the team? What different roles are there? Could you just give us a little bit of information about that?
Yes, so as I said previously, so we're a large team, we're split across 2 offices, and we have, so there's a paediatric oncology research office and the children's office as well. We have within the team, we have a data administrator, we have a group of research practitioners, which are, so we have more senior research practitioners and junior research practitioners, and then we have research nurses as well. And we have studies that we work on. Some are group studies, team studies, which, for example, the ATTEST study, so everybody is involved in covering the visits. And then we also have other studies where we work in the more traditional way, where a research nurse or officer will lead the study and deliver the study, working alongside the principal investigators, and we have principal investigators that are mainly consultants, but not always, working across the paediatric specialities.
I'm the first one to forget to unmute myself. It's going to happen. It's happened early. Lovely. Thank you so much, Helen. Liz, I'll hand over to you to ask the next question, if that's okay.
Okay, thank you, Rhian. So I think as a research volunteer, how will I support the children's research team on the ATTEST study?
So obviously I think it'll be a role that sort of develops as we see what everyone likes to do and how we see how the days go. But something that we really struggle with at the moment is just having an extra person there to answer the door, to greet the patients, to chat to the patients, you know, make parents a cup of tea if they need a cup of tea. Sometimes we need some help with running samples down to the freezer, or fetching bits of equipment. So really it'll just be nice to have another pair of hands, and also just as someone who can spend a bit more time with the patients. We would really like to be able to sit and chat with them during the visit days and chat with the parents, but we don't always have the time. So just having that person that, you know, maybe could even play some games with the children, or just talk to the parents and put them at ease, that would be really nice.
Lovely, thank you so much, Rhian. That sounds amazing. I'll ask the next question now. So what is AT? So it's the condition that we're looking at within the ATTEST trial. And how does it affect the children? Would you be able to expand on that, if that's okay?
Yeah. So it's a rare genetic condition called ataxia telangiectasia, or AT, and it's caused by changes in the children's DNA, which affects how their nerve cells work and affects their movement ability, their ability to fight off infections, and makes them more likely to develop certain cancers. The condition is kind of characterized by difficulty in coordinating movements, which is known as ataxia, and that's what makes it difficult for them to walk. They also develop these reddish lesions on their skin and on their eyes, and they struggle with kind of coordination of their eyes as well, and also difficulty with their speaking, and it can cause some drooling as well. So all of our children on the study, apart from their AT, I mean, they're happy children, and you know, even though it's upsetting to see them with the disease, they're happy to chat to you, and they're happy to be coming in to have their treatment. Some of them can walk around by themselves, but some of them are in wheelchairs or need help from their parents or us to move around. And they're between 8 and 14 years old, our children as well. So there's a little bit of an age range. But yeah, that's mainly I think what everyone would see when they came in to see the children.
Lovely, thank you, Rhian. Liz. Sorry, could I just add something there, just following up from what Rhian said about sort of their happy children. One of the assessments that we do is a quality of life assessment, and 9 times out of 10, when you ask the final question is about how well they feel today, and 9 times out of 10 they always answer 100%. They never let the condition get them down, and so which is really lovely to see. Yeah, thank you, Helen, for that. That is amazing to hear. It sounds like they are such resilient and happy children. So that's really nice to hear. Okay, Liz, would you like to ask the next question?
Yes, just following on from that. So Rhian, I know you said you were new to children's research when you took on this role, and that you were worried about maybe working with children upsetting you. Could you maybe tell us a little bit more about your experience with working with children?
Yeah, so before I came into this role, I was in the adult research team, so mainly working with adult patients, and that was just a completely different experience to working with children. Although sometimes when you're dealing with adults, it can be upsetting as well if adult patients are poorly. I know that one of my slight concerns when coming into the children's research team would be how I found seeing poorly children and dealing with them, especially not having had any experience of that previously. But like Helen says, the children on this study, they all are really happy. And it's lovely that we're able to deliver this study and deliver this treatment to them, because they are so grateful for it, and I think just grateful for the opportunity to be part of the trial, which is really nice. So it isn't something that I have struggled with, but I understand like the worries and the concerns that people may have around that.
Brilliant, thank you so much. And I just want to follow on from that as well, is that the ATTEST study, is it right that we are the only site in the UK that offers this study to children? Is that right?
Yeah, that's correct. Yeah.
Brilliant. Okay, thank you. Okay, so our next question is kind of leading on from that as well. Who would support our research volunteers if they did need to speak to someone? Perhaps they found a situation particularly upsetting, or they just had queries on the day while they're volunteering. Who would be there to support them a bit further? Would it be okay to answer that one?
So I mean, I think on the day, because we're always well staffed, there's either always 2 or 3 nurses on, and a research practitioner. Oh, sorry, cat is just about to walk across the screen. So yeah, and then we also have Juliana, the research fellow on, and 2 nurses operating the machine. So there's a lot of staff on. It is a busy day, but we'll always make time. If somebody's struggling with anything, there'll be somebody around to have 5 minutes with somebody to discuss something. And also, if they go away after the Sunday visit and they sort of reflect on something and want to talk about something, then somebody will be available in the week. Because the whole team are involved with this study, there's always plenty of people around.
That's really appreciated, and I think as well, it's a whole team effort for the ATTEST study, and also the research volunteers. Everyone always has the support from myself and Liz as the central point of contact, both during their day supporting the clinical teams, but also, as you said, at any time throughout the week if they've reflected and want to discuss anything. But it's really good to know that there's going to be, constantly the team around them to support them on the day as well.
We have a team huddle every week, either on a Monday or alternating Mondays and Wednesdays, and we just kind of at those meetings we look at what's gone well, what could needs additional support and things like that. So they'd be more than welcome to come to those meetings as well if they wanted to come and share their experience of being the research volunteer.
That sounds absolutely fantastic, and I think again it's emphasising the point that our research volunteers would, genuinely be part of, the children's team in supporting the clinical trial. So that sounds fantastic, Helen. I think we're ready to move on to what is our last question, if I'm right, Liz. Yeah. So would you like to take this one? That's okay.
Yeah, thank you. And I echo what Kate said about the volunteers being part of the children's team. That's really come across really well this morning. So thank you for that. The last question then is just in terms of the logistics of the clinic, could you just explain a little bit about maybe how many children come to the clinic? What do they have done while they're there? And how long generally do they stay for?
Do you want me to answer that, Helen?
Yeah.
So the children come into the hospital about once every month. There are currently 9 children on the trial, so they're split into 2 groups. So we have a group of 5 and a group of 4. They arrive staggered throughout the morning. So normally the first patient arrives at 8. And then they're staggered throughout the morning, and the last one normally arrives at 12 if there are 5 patients. And then if everything goes smoothly, each patient is there for maybe around 3 hours. It just depends, on how the day is going. When they first arrive, they have some vital signs taken, some heights and weights done. And then the nurses and our research fellow Juliana cannulates them or accesses their portacath. Some of the patients have portacaths in to access their veins more easily. So they're accessed so that blood can be taken for just general blood tests, and also then their treatment. So a large blood sample is taken from them, which is put onto the study machine called an Eridex machine, which processes the blood and puts the study drug dexamethasone into their red blood cells. And that process on the machine takes about an hour and a half, where the children, are waiting around. So that would then be a good point to have, someone to chat to or someone to play a game with or something. And then once their blood has been processed on the machine, it's given back to them via an infusion, which takes about 40 minutes for most of the patients. And then they have an assessment done by the doctor to check them over, some more vital signs done. Sometimes there's some extra assessments to do, like a neurological exam on certain visits. And some visits as well have an assessment called an ICARS assessment, which is looking at their walking ability, their coordination and speaking ability. So sometimes there's those little bits of extra things to do, which then can mean that the visit lasts a bit longer for them. But the general day normally finishes about 5:30 once all the patients have had their treatment. Yeah.
Thank you. Thanks, Rhiann.
Don't know if there was anything you wanted to add there, Helen.
And I think that covers it. I mean, I don't know whether we could just talk about if they come in for the visit they have every 6 months, when we see them on a Friday or Monday as well. And sometimes we need to, so they come in and they have a bone density scan and ECGs as well. And sometimes on those visits, we would need support with moving the patients between departments, whether that could be factored in as well.
Yes, thank you, Helen. Absolutely. I think that would be brilliant, because I mean, hoping with this study that we'll be able to build relationships with the patients and their families. So I think it would be wonderful if we could help with those visits as well, and providing that, you know, the additional support and care for them as we get to know them as well. So that sounds fantastic. Thank you so much for coming along. Thank you to Rhiann and Helen for providing such detailed answers for us. I would like to say, so we're going to be circulating this recording to our research volunteers. So if anyone does have any questions that are unanswered after this, then as Helen and Rhiann have stated, please get in touch, and we'll all be more than happy to answer those best we can about this. But we're really excited to get started, for the research volunteers to be supporting the children's team, starting with the ATTEST study, and then hopefully there'll be many more opportunities to get involved in other clinical trials as well across the children's team. Rhiann, Helen, is there anything you'd like to add before we wrap up?
I don't think anything from me, just that we're excited to have lots of help, and it'll be really nice to work with all of the volunteers.
Oh.
Yeah, I echo what Rhiann just said. Really excited to have you all on board.
That's brilliant. Yeah, thank you so much. And yes, we look forward to seeing you again soon. Right, thank you.